Welcome to the last lecture on the cardiovascular system. So today is going to be all about the arteries and veins of the body, the major ones, of course. If you want to study just anatomy in this class or gross anatomy, we go through a whole lot more arteries and veins if you'd like, but we're not going to. So major ones going to your head, your arms, your legs, and to your trunk. Yeah. And it's a lot like learning this lecture, learning a map, knowing the names of different streets are, and then streets change names. And so off the aorta, you have subclavian, axillary, brachial, radial, ulnar. But see that same artery changed names 3 times here, just between here and here. So streets will change names like that. Overall, arteries, a little more consistent. They're stronger. Veins are highly variable. And veins you can have on the surface of your skin. You don't have any arteries in the surface of your skin because they're under high pressure. It'd be dangerous to have an artery right next to your skin, wouldn't it? All right, well, let's go ahead and let's get started on this. Screen. All right. So, cool picture there of a person with their arteries and veins showing. And arteries and veins, are called vessels. All of them, either one. Beautiful. Look at that. All right, so of course, these are the pathways that get the blood moving to every inch of our body. And so they're going to perfuse all of our tissues. So none of them get ischemic, a lack of blood flow. So our brain, our gut, our skin, things that aren't well vascularized would be cartilage and ligaments, that have blood vessels. But even bone is filled. Remember, it's got a central canal, blood coursing through it. And so, indeed, depending if you work out, you'll have more blood supply. You'll have actually more capillaries growing in those muscles that you work out, especially aerobically. And, the stats like this, how many times the heart beats in a lifetime, but 60,000 miles of vessels. And those are nearly all capillaries because they're microscopic and you just have so many. They just fill every, inch of our bodies. And then, and again, down there, that why it's 2.5, because if you 60,000 miles, it'd be several trips around the earth. All right, and if you can look at this little diagram, it's just a real, simplistically taking a look at the 2 circuits, right? Blood is going to return to that right atria, the right side of the heart, to the vena cava and the coronary sinus. And then the pulmonary circuit is going to send blood through pulmonary arteries to the lungs. I'll show you how that picks up oxygen, pulmonary veins back into the left atrium, into the huge left ventricle that's going to pump it out, the aorta, to the body. And then all the veins carry it back. So those are the 2 circuits. As long as your heart is in 2 separate right and left sides with the intact septum, blood doesn't mix. This technique here, you can see these are the arteries in the hand. This is from Body Worlds, Body Works. They do this, and I've done this before. I took a cadaver. You can buy liquid latex, and then I got a big bore syringe and put it into probably the brachial artery here. Then we cut the fingers underneath the finger pads, and then put the syringe in this artery, and then tied it off with it tightly, and then push the latex. And it went through the arteries and eventually dripped out the fingers. And then we just waited, and that liquid latex will harden into rubbery latex before too long. And then you can, as you dissect the arm, you can see that the arteries are stained bright red because they have red latex in them. And go blue in the veins. And that's when you have fetal pigs, or we're going to dissect kidneys in a bit, and you'll see that they're injected with latex. And so this is just a beautiful job. Look at all the blood supply in your hand, especially look at the tips of the fingers and the thumb. You see that? Just amazing. Here's a cast of the capillaries in the lungs. The vessels in the lungs. Just look at that. Look how delicate. And so you have actually the surface area there of half a tennis court. And blood vessels just beneath it and air above it. That's kind of cool. You can look through to the back of the eye, the back of the retina, with that ophthalmoscope. And you'll see, you guys remember, this is your blind spot. I know you all remember that optic disc. And this was the fovea. That's where you have all the cones. That's where you have the best vision. And so you can see the arteries come and they stop. They don't go over that fovea, so you just have really sharp vision. There's no blood vessels in the way blocking it. Just beautiful. And you have diabetes or such, they'll often look in the eye because these delicate vessels here can be easily damaged by persistent high blood sugar. Thyroid gland. All right, I'll stop. But you can just see when you make a cast and you look at the microscopic vasculature, it's just beautiful and just amazing how blood gets everywhere to serve all those trillions of cells. And remember, the blood doesn't actually wash over the cells, but the liquid will come out of the capillaries, wash over the cells, and come back. And in that liquid will be glucose and oxygen, carbon dioxide, and ions, everything. All right, so first we'll start pulmonary circuit. And again, I hope you guys, by this time, after my lectures and the labs and everything, that you're getting this anatomy down. I hope so. If not, you're behind at this point. You should know the heart anatomy. You start the blood returning to that right atrium. And that's the blood that's deoxygenated. It's been used up by your body. And so it goes in the right ventricle, and it's going to go out the pulmonary trunk through the pulmonary valve to the pulmonary trunk, and then right and left pulmonary arteries. And they are blue. But remember, the rule is arteries go away from the heart and veins go towards the heart. And then we'll see in the lung itself, you will see the capillary beds where exchange of oxygen and carbon dioxide takes place. So just through simple diffusion, there's no active, no energy. It's just you put two things close to each other, and oxygen, carbon dioxide, other things are going to move from the high to low concentration through diffusion. So just make a big wet enough lung with enough blood next to that air, and that will naturally will exchange gases. And then when it's got its oxygen in the lungs, it's going to return to the heart through right and left pulmonary veins. There's usually 2 and 2 from each side. And those veins are going to the left atrium, and then onto the left ventricle, the powerhouse, that will pump it out to the body. Call it the systemic circuit, out to your system. Back to the right side, pulmonary circuit to the lungs, left side, systemic circuit. I get a little more detail here. If you get down to the point of, we'll get to this respiratory system pretty soon, is that this exchange of gases takes place because you've got air. You've got air in these clusters, these little round sacs that are filled with air. And you want the blood just beneath it. And you want a moist membrane. You don't want water in those alveoli, those sacs of air, but you want it to be wet so that you can have gases dissolve. And if you look at it, the blood's going to come in. See, it's blue because it's coming from the body. It's already used up its oxygen. And as it travels along, it's going to have some pressure, and fluid is going to leave. Fluid and salts, things like that, is going to leave like that. And solutes, those dissolved substances, they will build up in this interstitial space here and before the alveoli, but outside the blood vessel. And because there's so much stuff in here, it tends to suck any water that gathers in the alveoli out, right, just by osmosis. So it keeps those sacs wet, but not filled with water in your lungs, of course. So that osmosis does that, sucks it out under normal conditions. And on the other hand, you're going to have the water return to the blood, or the lymphatic vessels will take up some of that excess water. This is when things work well. And along this path, you're going to have exchange of gases. Oxygen, carbon dioxide will follow their concentration gradient. All right. Well, what can happen? Well, something I want you to know is pulmonary edema. Sadly, very common. And this is when the lungs fill up with fluid. So what's going wrong with that, with what I just told you? Well, imagine there's too much pressure, too much blood pressure. I talk about the pressure caused fluid to leave, right? But if you cause a backup, let's say the heart can't get rid of it, can't get rid of the blood on that left side, it's going to back up in those lungs, that pressure, and more fluid is going to leave because it's being pushed out by that higher pressure. And then that fluid will start going across that membrane and start filling up the alveoli. And so you drowned in your own fluid with pulmonary edema. I mean, it's not, they can reverse this, but pulmonary edema can lead to death, of course. Yeah. And I just put this on here because you guys know some of this stuff, these terms. I just thought it'd be kind of fun. Look at that. So asymmetric pulmonary edema. Asymmetric means it's on one, it's not symmetrical, it's only on one lung. I'm guessing that one. And with rupture of a papillary muscle, you know what that is too. That's what holds the chordae tendineae so the valve doesn't flip up. And then you're going to have mitral regurgitation. So you know this is going to be on the left, between the left ventricle and left atria. You know that the papillary muscle busted and now the valve is coming up instead of stopping. Look at that. And so the left ventricle is trying to get rid of the blood out your aorta, but it keeps going back up to the atria. And then it'll back up in the lungs because that's where the next place is. So yeah, here's pulmonary edema. So you should all know it's fluid that's going to leave if there's too much back pressure of blood. If the left side, if your heart is failing, it can get rid of it. It's going to build up back there. If your right side can't get rid of the blood, it's going to back up in your vena cavas. And so you're going to have edema in your neck and your limbs and coming into your abdomen even. So you can see how important it is that the heart get rid of the amount of blood that returns to it. And if it can't get rid of it, if it's failing because the valves aren't working or the muscle's giving out or something wrong with the electrical, then you're going to have a backup somewhere where the heart can't get rid of that blood, and you're going to have fluid leaking out of the tissues because pressure will increase in those veins. All right. All right, so the pulmonary circuit, we got that. And take a look at this heart. For those of you that have dissected the sheep's heart, you're like, so he wasn't kidding. That left side is freaking thick, and the right side is really small and wimpy because you don't need much pressure to pull it out to the lungs. They're right there, so it's a low pressure system. The left side is high pressure as it goes out the aorta to pump it out to your body. All right, so big obvious difference there. Yeah, so let's look at the systemic circuit. And that's really the rest of this lecture. So here's some arteries for you. What do you think? You can peruse those, see which ones you know. We'll talk about them, and some of them make sense, right? You all know your, well, gonadal is going to go to your ovaries or testes, your femoral artery in your leg. You got that one, right? Vertebral artery. We studied that with the vertebrae. It goes up in the cervical vertebrae through that hole, that transverse foramen, up into the brain. You might know this big artery in your neck is the carotid, right? And then renal is going to be in kidneys. Suprarenal is going to go to your adrenal glands. All right. Let's get right to it. We're going to go right through them all. First is this aorta, and lab. I'm glad you see models of hearts, but looking at a real heart and an online lab too. Look at the pictures of the real heart. You get to see it looking in real life. You get to see what the valves look like, et cetera. You can't really replace that. You can't duplicate that with plastic, So anyway, beautiful view here, the aortic valve. Oh, that's nice. You can see in that picture, blood can shoot out at you. If it tries to go back into the screen, those valves are going to snap shut, causing a little double as it goes out. You cut that aorta open, as in a dissection, and it looks like the upper figure right there. So you can see it has these little half moon crescent-shaped valves. Actually see, I believe it's going to be the opening of the right and left coronary artery right there as well. All right, but the aorta is the biggest artery in your body, the thickest, the strongest, the highest pressure. It'd be in the ventricle and then in that aorta, because that left ventricle is going to shoot blood out. And we call this the ascending aorta. This is the arch of the aorta, then the descending aorta. And in your body, practically, when you look at a body, we call it up here in the chest, the thoracic aorta. And then when it gets below the diaphragm, we call it the abdominal aorta. So that's the main vessel carrying your blood. What do you think? If I ask you what are the first arteries to come off the aorta, you say the right and left coronary. The heart gives itself blood first. Then it's going to come up and make this arch. And there's going to be 3 vessels coming off of it. They're going to go to your head and neck. And then it's going to go down to the left along your vertebrae, giving branches to your chest wall. And it's got to split to go to your legs eventually. Yeah, beautiful. You can see I redacted some things. So even in your book, you need to know for the exam, I will ask you questions like this, like which one of these arteries is going on your pinky side? Which artery is going to go to your small intestines? Which artery is going to go to your leg, and give you a list. So you need to memorize vessels that I give you, and I won't ask you the ones that I don't give you. All right. Well, interestingly, I guess I should tell you this. Here's your heart. And if you have normal distribution of vessels, you're going to have an aorta coming off to the left. So since it comes off to the left, and let me just tell you, if you were to look at a frog or a fish, it's going to have one that comes off the right too. It's going to be these paired vessels. It's going to be like an arch. And I'll just tell you, in birds, it goes off to the right. So in case you guys care, is that it's important actually, because you need to know the development of this. And so early on, it was a double. And then for some reason, mammals, the right side just degenerates and we're left with an aorta going to the left. There's rare cases where it goes to the right, or it's double, but it's very rare. So our aorta goes to the left. Because it goes to the left, my drawing, damn it. So this would be a bird, okay? But this one's the one that's actually gone. Yeah, it's not worth erasing. So our aorta comes off this direction. And because it's going to the left, you can have the artery that goes to the left arm and up the left side of the neck. But on the right side, it's kind of like arching away from it, right? So you have this common trunk right here. It's just pretty small. And then you have the ones going to your head and to your arm. So see that? See why it's on the right side? Because the left side, they come off and they're going the right direction. But because it's arching this way, you have a little common, it's like an inch long, this common piece. It's called the Brachiocephalic Trunk. And brachio means arm, cephalic means head. So it's the arm head little trunk or artery. And that's just this little piece right here. Yeah. And the two come off it. I'm going to show you soon, but these are the carotids come up to your head and the subclavians will come under your clavicle to the arms. All right. So we'll look at the aorta with its coronary arteries coming off of it. I just mentioned these things that come off immediately of these three branches that come off. And then the descending aorta will continue down through your diaphragm, down, split to your legs eventually. And then we'll look in your gut cavity, and we'll talk about three. The celiac will come off first, then superior and inferior mesenterics. They come out to your guts. And then gonads go to your gonads. And then renal goes to your kidney. Suprarenal goes to the adrenal gland. No problem. And then we'll see the aorta will split to go to the legs. And those will be iliacs. They come over your pelvis, the ilium. That'll turn into femoral. All right. So back to this. Let's take a look. You can see that aorta. Look at that thing. Beautiful. It's huge. Here it is ascending. Here's the arch. That's going to be descending. And as I promised, you have the brachiocephalic artery. I call it a brachiocephalic trunk, brachiocephalic artery. And it means arm head artery. Brachium is arm, biceps brachii. So yeah, it's your arm head artery. There's a little piece right there. And it's only on the right side. And then the ones we're interested in are going to be the one going to up your neck. You can feel the pulse deep in your neck are the carotids. We'll call them the common carotids. Oh God, I feel it right there. Yeah. And so they're going up to your head, the common carotids. It's the jugular veins that come down. You've heard jugular veins. Go for the jugular, but these are the carotid arteries are deeper and they go straight up. And then the ones going to the right and left arm are called subclavian. So you have a right and left subclavian. And the left subclavian comes off directly off the aorta, usually. And then the right, will be a branch coming off that brachiocephalic trunk. All right, what do you think? Hopefully I didn't beat a dead horse or go too slowly for you. I'm always keeping in mind, this is new to a lot of you, so I'm just trying to take it slowly. And I guess you guys could slow it down or watch it twice. All right, and so then the aorta takes a trip, goes down the left side of your chest, like deep behind the lungs and the heart, along the vertebrae, and it's going to pierce the diaphragm and go into the abdomen. And we'll see, we're going to have celiac, superior and inferior mesenteric are going to be three midline branches coming straight at you to go to the guts, the intestines, the stomach, the spleen, the liver. And then eventually when it splits to the legs, these are going to be the common iliacs over your ilium, part of your pelvis, right? And then you all know gonadal is your gonads, and then kidneys and adrenal glands. So these are the major branches I want you to know. Look what it looks like for real. You can see this hole in the diaphragm here. And there's arteries that feed the diaphragm underneath it like that. There's all kinds of things we don't get into. But you'll notice right after the diaphragm, a big branch coming straight out. And that's going to go to your stomach and your liver and your spleen. So it's a big branch and part of your stomach there. And then you have one coming here, be your superior mesenteric. And then down lower, be the inferior mesenteric. This goes to your upper intestines and kind of your lower intestines. I mean, just to make it simple. Yeah. And then here's your big old kidneys. You all know what your kidneys are. I haven't taught it yet, but there they are. And you can see big renal arteries, renal going to kidneys, renal disease, kidney disease. Renal means kidney. And then branches going to your suprarenal glands will be your suprarenal arteries. That's pretty easy. Yeah. And then these ones come way off from up here all the way down to your gonads, whether you have ovaries or testes. Yeah. And I'll explain why they come off so high. Why don't they come off down low? I'll tell you. So here's the celiac trunk, the first branch. And you don't have to know these branches, you know, for my class, right? If you want to get into it, you'll know this is common hepatic, left gastric, and splenic. So the artery going to the spleen is called splenic. You don't have to know. Okay, I'll stop. Gastric is your stomach, of course, and hepatic means liver. So that's the main branches off the celiac trunk. So you need to know if I ask you, what's the artery that goes directly to either the liver or the spleen? It's got to be that celiac. The superior mesenteric comes off and just shows you, I know it's complex, but just know the superior mesenteric goes in the mesenteries, that's where it comes from, that are going to hold your guts, your intestines. So superior mesenteric goes to all your small intestines, and then most of your large intestines, ascending and transverse. Yeah. And then inferior mesenteric comes down lower, and that's going to go like the descending colon and like your rectum, the end of the line. So the superior mesenteric is the big one, all those small intestines to absorb your food, and then most of the large intestines. And then the inferior one's smaller, and it goes to a little bit of the colon, I mean, half the colon, and then the end part. All right, we move quickly here. You know, if you look at that diagram and you just want to like memorize it all, that's going to take you longer. But I'm hoping I break it down to the ones you need to know, and you make a list, you draw it out, you're able to answer multiple choice questions where I'm going to ask you about these. All right. Head and neck, that's super important, isn't it? Ooh, that's a lot. There we go. You got to redact some. Beautiful. All right. So what is giving blood to your face, your tongue, and your brain? All these things in your head. But you know you bleed a lot if you get hit in the scalp, right? So a lot of blood supply. Your brain is greedy. It needs lots of glucose, lots of oxygen. So big blood supply. You can't cut that off either. You pass out and you die pretty quick, right? All right, well, the big one coming up is going to be the common carotid. There's a right and left that comes up your neck, deep in there, and big old artery, common carotids. And it's whenever you hear common, it means it's common, it's going to split into two. And so the common carotid is going to make an external carotid, and that's going to go up on your head. It's going to go on your face, in your tongue. So it's going to go not to your brain, but your head and the facial features, external carotid. The internal carotid doesn't have any branches. It goes right into the brain. It's going to go right in through a hole into your brain. But the external is going to do all this. You know, when you're bleeding from your face or your chin or your tongue, it's going to be branches of the external carotid. And then looking at this picture, your brain doesn't rely just on the carotid. It has a backup. There's another artery that goes called the vertebral artery. And that goes through those transverse foramen of the cervical vertebrae that we learned in the bones. Remember, the cervical vertebrae have those holes? Vertebral arteries. They come up, they're going to go in the foramen magnum and into your brain. They're going to meet the carotids. Yeah. Oh, gorgeous. Look at that. It's just a diagram, but still cool. And don't forget the term aneurysm. This is a beautiful, well, it's not beautiful for the patient. It's a huge aneurysm, let's just say that. So this vessel has ballooned out. And you may be fine at this point, but a little more high blood pressure can burst, and you'll hemorrhage in your brain. All right. At the bottom of your brain, like we studied the brain, we didn't really look at the arteries. Now we're going to look at the arteries. There's quite often a circle right here. And it's called the cerebral arterial circle. I learned it as the circle of Willis. I don't know if you'll hear that again, but the cerebral arterial circle. And what happens is that you see these huge internal carotids I talked about, and they're going to meet these two vertebrals. And the vertebrals come together. They make this basilar one that comes as one beyond your brainstem and your medulla, and they're going to meet. So here's from the vertebrals, there's usually a little connection here, here, here. So it kind of makes a circle. To be honest with you, it's not always complete. But the idea between the circle could be that if one part is blocked off, the other ones can take over, right? Because it's a circle. And from that circle, you have all these cerebral arteries that feed the brain. So imagine if one's blocked off. Well, then if you have a circle, other ones can take over, right? Another idea is kind of the blood comes up and it kind of equalizes the pressure in the circle and then sends it out. So anyway, you have this circle at the base of your brain that's made up of the internal carotids and your vertebrals that come together. And that, I won't ask you the branches on the brain at all, but it's going to give all these branches off to your brain itself. Cool. There's an idea. I like weird medical things. And there was a case of an elderly person would back out of the driveway and then would faint and get in an accident. Like, how come that keeps happening, And it turns out those vertebral arteries, they come up, they take a sharp turn above the atlas, and then they're going to go up into the brain, right? And if there's occlusion to that, when you turn your head, it can compress that and cause a little lower pressure in the brain. That's kind of a cool story. All right. Ooh, let's get rid of some of these. This is like some game show. Let's get rid of some of these. So let's look. So that was it. What did we learn about the head and neck? We learned that we have a common carotid and vertebrals are going to come up. And the external carotid is going to give branches that you need to memorize in another class all over. And the internal carotid is going to go into that brain. And the internal carotid, the vertebrals make a circle, arterial circle that's going to feed the brain. So really, we're taking a really complex subject. I'm just breaking it down to the basics. All right, what do you need to know about your limbs, your guns, your whole arm to your hand? Clearly a lot of blood flow, right? Well, what's going to happen is we learned off the heart, you're going to have subclavians under the clavicle. And so you're going to have a right and left subclavian. And when it comes out from under the clavicle and it's in your armpit region, like right here, and that armpit region is called axillary. And your axilla is your armpit. It's a fancy word for armpit, axilla. So axillary is for the piece between the subclavian. And then once it gets into the arm, past this muscle, it's called the brachial. So brachial means arm. Biceps brachii. Yeah, and so that's the brachial artery. Sometimes a compression point there in your arm. And then that's going to come down to your elbow. And it's going to split to the right and left. And it's going to be simply the radial and ulnar, just like the bones, right? And you remember radial is always thumb side. Ulnar is always pinky. Beautiful. So you can feel your radial pulse right there. Your ulnar pulse will be on the other side. And if you want to know where they're going, they go into the palm. There's a deep and a superficial arch, then they feed the fingers. But we're not going to go that far. Yeah. So subclavian, axillary in my armpit, brachial here, and then radial and ulna down in my forearm. Just like that. This whole slide is just to show you that the arteries between the ribs are called intercostals. The muscles are called intercostals too. And so the artery and the nerve is called intercostal. So intercostal would be between rib. So between each rib, there's an artery. And you can see it comes from off the aorta, and there's a little bit that comes off some arteries in the front. Look at us, we're moving. That's it. All right, the legs. Well, first the aorta comes down and it's got to split. It's got to split somewhere, right? It's got to get to the legs, right? You're going to run out of real estate if you keep going straight. And we'll see that big aorta is going to split into two common iliacs. All right, it does. Yeah. So these are common iliacs here. And then you're going to have a small branch will be these internal iliacs. It's going to go into your pelvis, go to things like your bladder, your ovaries, things like that. It's going to be internal. And then the external is going to leave the pelvis and go out to your legs and turn into femoral. All right, so internal iliacs are going to go to your colon, your bladder, all the things in your pelvis. And then the external iliacs will be on their way out to the legs. Once they get into the legs, we call them femoral arteries. They're going to run down your leg. In the back of your knee, they're called popliteal arteries. And then there's going to be a branch that goes down underneath your calf muscles, posterior tibial. And there'll be a branch that comes forward and goes in that forward compartment, the anterior tibial. So far, so good. For the arm, we had radial and ulnar, just like the bones. Here, remember, we have femur and we have tibia and fibula. So we have femoral and we have tibial, we have anterior and posterior. Posterior would be back in the big calf. Anterior would be up in the front compartment. So looking at it, you can see here's the common iliac is going to be the two main branches. Yeah. This place right here is a common place for an aneurysm too, where the aorta splits. Kind of like if you think of a stream as it splits, there's pressure, right there where the water splits, right? And so you can have that balloon out, an aortic aneurysm. And you can feel that if you palpate the abdomen, you can feel that pulsating aorta in there if you have an aneurysm there. All right, but let's say we don't. Then you're going to have common iliacs, and then you can see the internal iliac. Look at all these branches you don't have to know. Beautiful, right? All these branches that go to the inside stuff, internal iliac. And the external iliac is going to leave, and it's going to come out the front of your thighs. Ooh, can I get rid of some? I guess we learned all these. I already got rid of some. All right, yeah. So yeah, they're all here. All right, and then so here, this is your femoral artery, and you all know, a gunshot wound there, you're gonna bleed out really quickly. So it's a big artery carrying a lot of blood right to your legs. So the femoral artery is gonna come down. It's gonna feed, your quads, your hamstrings, all that kind of thing. And it can't go in front of the knee, can it? Do you have an artery in front of your patella? No. So it's gonna go through a hole in an adductor muscle to the back of the knee. We call your back of the knee, it's called the popliteal fossa, this depression. Popliteal fossa is the back of your knee. There's a lot of fat back there. It's a place where you get deep vein thrombosis, right? DVT, because blood will pool there if you're not moving your legs too much. But anyway, this femoral artery will go through a hole in the muscle in your leg, and the back of your knee is called the popliteal artery. It's all about this long in the back of your knee, goes in the back of your knee. Before, it's going to go down to your calf region, past your knee. And then the major branch is going to keep going down the back of your calf. It's going to go down, it's going to go under your foot, and it's going to go to your foot, the under your foot, all that, the thick, meaty part of your foot and your toes. But there's going to be a branch that pokes forward to the front, smaller branch, going to go down the front of your shin. Not on the bone, your tibia, but it's going to be in those muscles, deep in those muscles will be the anterior tibial. And that continues down, it comes off the top of your foot right here. And that's a place that was mentioned where you can feel your pulse, this dorsalis pedis artery on the top of your foot. There's an artery. You can feel your pulse there. Yeah. What do you think? Similar, looking at the arm and the leg, you've got a major branch, and then it's going to split in two in your forearm and two in your calf region too. Here's another view looking at the back of the leg. So here's popliteal. The back of your knee is called popliteal. It was femoral before it got to the back of your knee. And then you can see here's the branch. It's going to dive forward to the front of your leg and go down. And then the major branch is going to continue down the back of your leg. And we won't get into any more detail. And that's, of course, going to serve your foot too. Lots of blood down there. All right. Damn, that's it. Okay, I know you're thinking that's it, Parmalee, right? But when you write a list out, it's not overbearing at all. All right. The veins. Now, veins are more variable, definitely. I'm looking at all these, and a lot of the veins have the same name as the arteries. So you have a femoral artery, you have a femoral vein. Popliteal artery, popliteal vein. Radial artery, radial vein. So arteries and veins run together with the same names. Now, you also have superficial veins. You can see them on your people that are bigger muscles and less fat. You can see, see veins underneath their skin that can pop out in your neck. Back of my hand, you can see them on the top of my foot, right? So we have superficial veins too, that we'll talk about, the major ones. Yeah, so indeed, I would say definitely that arteries are more consistent and they're easier to name. So often in gross anatomy, a list of arteries, and then veins that are superficial or unusual we'll name. But you can see that they anastomose, or they the back of your hand, like everyone's different. It's almost like a fingerprint, how this pattern of veins. But the bottom line is that the blood gets back to your body, back to your heart, through all these veins. And so they can be more variable. Yeah. So pretty much the veins that are going to drain your brain and your face, your head, are going to be the jugular. And just like the internal carotid served your brain, the internal jugular is going to drain the brain down there. The external jugular is going to drain your face and your head and your scalp and your tongue and your sinuses, all right? And again, highly variable, but that internal jugular is big. External jugular does all kinds of things. It's really messy in gross anatomy. So all of these veins will drain your brain and your scalp. And the external jugular is actually above sternocleidomastoid. So it's quite superficial. And if you cut your neck, go for the jugular, the vein is right there. And it will spurt blood. But if you were to hit the carotid artery, it would shoot blood across the room. So the vein has less pressure, but it's very superficial. Yeah, I was just thinking, IV drug users know veins really well. I was just thinking, I've seen shows where they use veins in their neck or on their foot or in their arm, things like that. So these superficial veins, you can make pop out, especially you put a belt or a rubber band on your arm. Everything, the superficial in the skin is going to pop out. And so you can find them if you're trying to inject something in them. Why did I go that direction? Sorry, but these are things I like to share with you. All right. And vertebral veins are just like the arteries. They run in that transverse foramen. Damn, that was easy. So internal, external, jugular, and vertebral veins drain the head. All right, here we go. I'm talking about, again, if you have very little body fat, you can see your veins in your skin more, right? So if you're very slender, you can see veins in your skin more easily because of the fat. I've got fat that hides those veins quite a bit better than those of you with less fat in their skin. So these superficial veins, they run in your skin. You can see that. And they are going to come back. They're draining blood back to your heart. The deep veins are within. You have deep veins in here, superficial veins, and they're all going to be bringing the blood back to your heart. And so if you were to stop a superficial vein, no biggie. The blood just goes to the deep one. You clog the deep one, blood will start going to the superficial ones. Yeah. And it's sometimes an issue when you look at if your liver, this big hepatic portal vein goes through your liver, and if you have it's called portal hypertension, you have a blockage of your liver, the blood can't go through it, like lots of blood, right? So the blood starts looking for other paths, and you'll have blood vessels, veins around your belly button and around your esophagus will start swelling because the blood has got to find a way back if your liver is clogged. So what I'm saying is that blood will find a way back through the easiest, the less resistance. And so you can block off some, but then the other one's got to take up the slack to get that blood back. Yeah. And the veins in your legs and arms, the ones that are deep, they're within that tough fascia. Remember that fascia lata around there? And so your muscles are in there and they contract. Remember your compartments? Talking about compartment syndrome in your calves. And so as the muscles contract, they're really going to squeeze that blood up the veins. And that really is going to help get the blood at least back to your abdomen, and then breathing will help get it back to the heart because you have a hard time getting blood back from the veins. All right. Often, if you have an artery, you'll have what's called vena comitante or companion veins. There's often a pair of veins that go along with the artery. All right. So in your arm, let's look at some superficial veins. And some of you in your class can make them pop out. You got a vein that comes down here along your deltoid or your biceps, other veins. And so, yeah, can show those off. So looking at the veins of the arm, there's a couple I wanna give you that are kind of special here. some superficial veins. And what you're going to have is that there's going to be one. Let me see here. So jump ahead. Yeah, we're going to talk about the cephalic vein. What does cephalic mean? It means head. All right, so we'll see. What's going to happen is that I'll show you. On the outside, it's going to come from your thumb side. So you have veins in the back of your hand. And it's going to come on the back of your arm on the thumb side. And you're going to see it coming up your biceps. And it'll come up this little groove between deltoid and your deltoid here and your biceps, and it's going to go in here. So some of you have a nice pronounced vein coming down the outside of your arm, all the way down to your hand. It's a cephalic vein. Yeah, so cephalic vein. Huge vein, yeah. It was named that head because, I haven't gotten into this, but in the old days, one way to, we thought medicine work was bloodletting, right? Leeches, or we would bleed people. We thought that would get rid of the bad humors. The disease would come out with the blood. And this one, it's possible, it's thought it was to cure headaches by draining the cephalic vein. That's one hypothesis. We don't really know for sure. And on the medial side, you have a basilic vein. And the basilic vein is going to come on the other opposite side, and it goes up the inner side of your arm, and then it's going to disappear in here. So a couple of superficial veins. When you look at your arm, cephalic is on the thumb side, all the way up your arm. Basilic will be on the medial side. And then they meet here. There's usually a connection right here. Right there. I know I have a slide. Here we go. So this front of your elbow here, this depression, is called your cubital fossa. Fossa is a depression. And back in the day, when you measured the Noah's Ark or pyramids, things like that, a cubit was one unit of measure. A cubit was from someone's elbow to the tips of their finger. Not the best measurement, because a tall person or a short person, your measurements are going to be way off, right? But that was a cubit, was a unit of measure. And we call this a cubital fossa. And then there's a median cubital vein that is going to, most people, I'm just saying, that usually kind of pops out between your cephalic on the lateral side and your basilic on the medial. So there's a little connection between the two. We call the median cubital vein. The only reason I bring it up is that venipuncture, when you take phlebotomy, when you take blood, it's a good place to take blood, right? Or give an injection, put up an IV. Well, IV is easier in the hand usually, but you can get to the veins right here, obviously. So that median cubital vein, and everyone's really different, it's why phlebotomy, you can't just close your eyes. I mean, you got to see where your veins look like. Let me look at the other arm, right? Because it's variable, but just generally everyone has a cephalic and a basilic, and then a median cubital of some sort that are going to connect the two. All right. And those of you into phlebotomy and that kind of thing really know the superficial veins of the arm, because we work with them every day. And I just want to show you, this is what the inferior vena cava looks like. It's gonna mirror the aorta. So the aorta is not drawn here, but it'll be right next to it on the left side. And then the vena cava is on the right. It's similarly big. And you have similar veins like the renal and suprarenal we talked about. Instead of common arteries, common vein. So a lot of the same names. Cool. You guys like trivia? I mean, you like simple, what do I need to know for the test kind of info, right? But I'll show you the gonadal veins. They and if you get it, I taught gross anatomy for years. I mean, this is the right gonadal usually comes off the inferior vena cava, and then the left usually comes off the renal vein. I don't know, fun fact that I will not ask you about, but you can see that. So these veins, same name as the arteries, but we'll talk about some special ones. Oh, I like this. This is an actual gross anatomy picture. The guts are taken out. But this is what it looks like in real life. Can you see that the aorta is white and solid looking? And then look at the vena cava, inferior vena cava. You can see it looks like paper thin, right? Like very, very thin. I want you to see that's what it's really like. Like I say, the models are all plastic. They're just different colors, right? But here you can really see the aorta is carrying high pressure blood. And then the vena cava is much lower pressure. So the wall is much thinner. Cool, huh? Look at that. It's gorgeous. I mean, this dissection, look at that. So you can see the aorta, you can call that the abdominal aorta, and the inferior vena cava right next to each other, giving off all their branches. All right. Hepatic portal system. Again, you guys need to memorize hepatic means liver. Hepatitis, disease of the liver. And we'll get to this at the end of the semester. And a portal, like there's a portal to a new dimension. It's kind of a pathway, a hallway, a connection. A portal system here in anatomy is like going from one capillary bed to another capillary bed. Yeah, that's rare. Usually blood goes to a capillary bed, into the veins, back to the heart. But in this case, let me just tell you that all blood that goes to your intestines and your stomach, wherever there's absorption of nutrients and water and things like that, the blood doesn't go right back into the veins. Instead, it all goes through hepatic portal vein to the liver. So the deal is the liver is going to filter the blood that comes from what you absorbed. So you eat a bunch of sugar, you drink a bunch of alcohol. You don't want that going right to your brain. The liver, this huge organ, is going to have a chance to store that sugar or try to break down that alcohol. There's also a lot of bacteria that come in through the guts. Think about your colon and your gut. And so the liver has lots of macrophages that can also filter that blood too. So anything that you're going to absorb, you want to go through the liver, and it's called the hepatic portal system. So it's pretty cool. Where else have we seen a portal system? One capillary bed to the other. Not really fair for me because I know this stuff. The pituitary gland, right? The anterior pituitary had releasing hormones from the hypothalamus that went down blood vessels into the capillary beds of the anterior pituitary gland. Yeah, and we'll see it later in the kidneys too. And this is just a beautiful illustration showing you're absorbing things in your stomach, intestine. Turns out your spleen goes in there too. The hepatic portal vein is big and it's shunting all this blood from your intestines mostly into the liver. The portal vein will carry it to the liver. And those liver cells can take care of everything in the blood and return it through hepatic veins to the inferior vena cava back to the heart. It's done. It's been worked on by the liver. Cool, huh? Yeah. It turns out the liver can't survive on just portal blood because it's really low in oxygen. I mean, it's filled with nutrients if you just ate a meal, but low in oxygen. So there's also going to be a hepatic artery that's going to come directly and serve the liver. So liver gets a mixture of portal vein from your guts and fresh blood, so it can be healthy. Yeah, you don't need to know the branches, but this huge vein entering the liver is the hepatic portal vein. And you can see it draining the intestines, the stomach, the spleen, even the pancreas. All these things are going to be drained into that liver. Cool. And again, I showed you this in an earlier lecture, kind of big picture. And here you can see, let's say this is the liver here. You're going to see all the blood from the intestines is going to go through this hepatic portal vein and the spleen. And then the liver itself, I said, gets blood from the hepatic portal vein. It also gets fresh blood. We'll talk about later. It's about 30-70. Cool. And then once it leaves the hepatic vein that drains the liver, that blood's been worked on by the liver. So it's been detoxified and sugar has been stored and cholesterol taken care of, whatever the liver is going to do. All right. All right, we're getting close here. All right, hang in there. So let's get to the veins of the lower limb. You can see without much body fat, the veins can really stick out. So deep veins, you're going to have a femoral vein with a femoral artery, popliteal vein with a popliteal artery, posterior anterior tibial veins, same name, right? But we have two superficial veins in your leg. And on the medial side, you can see it in this picture right here. It's called the great saphenous vein. And I actually mentioned that in a lecture yesterday. Earlier, I talked about last week, I talked about bypass surgery, coronary bypass. And they often take a piece of this great saphenous vein because it's a big, easily accessible vein. It's right in the skin, and they use it for the bypass. And then the small saphenous is on the opposite side. It's going to come on the lateral side of your calf, and it's going to dump in behind your knee. This great saphenous goes all the way up the inside of your thigh. It's the longest vein. Yeah, here's showing this great saphenous vein coming all the way off your foot. I come off this medial malleolus, all the way up your calf, all the way up your thigh, and it'll come in up high on your thigh. It'll come in there. It'll also drain some blood from the groin region too. Small saphenous, show it. Yeah, on the other side, we can see small saphenous. A vein on the, instead of being on the medial side, it's on the lateral side. It's going to come actually behind the malleolus, like, I don't know if you guys care, and it's going to come in behind the knee. So there you go. When you look at a leg, this is, let's say it's the inside of your leg, you've got a great saphenous that's going to come all the way up your thigh. And on the other side, you're going to have a small saphenous that's going to drain the lateral side. It's only in your calf. Ah, beautiful. All right. So we've gotten through the major arteries and veins, right? Arteries a lot of time, and then veins, we did some superficial veins that are just obvious and important to know in anatomy. I just put some slides here, taking a look at the finish off cardiovascular system. You can see in the fetal life, the heart's beating before you're born, right? And it's just kind of interesting looking at heart rates up here in the 150s. So you start out with your heart going twice as fast when you're little, right? Your cat and your dog, feel your cat's heart rate is up in the hundreds too. Oh, speaking of, when you look at different animals, their heartbeat and how long they live. And you can see if you have a slow heart rate, you usually live a lot longer. If you're a mouse or a hamster, oh my God, heartbeat of a mouse is 500 beats a minute. Oh, Jesus. And so that thing's just flying, and though it has a long lifespan. They didn't put a bat on here. A bat would also throw this off. They have an ass. That's weird. Use donkey or something, but bats are very small, but they're quite long-lived. And where's humans? Oh, we're kind of out there a little bit, aren't we? So we have obviously a long life expectancy, but we've got a much higher heart rate than some animals just a little bit bigger than us. All right, a horse is a lot bigger than us. Cool. So, bottom line here, if your heart's beating really fast, you usually don't have a long lifespan. All right, another thing, of course, you guys, a lot of exercise. I should be, but you can see, about your heart rate, and oh, I'm gonna get aerobic activity, fitness. I'm gonna try to lose weight, things like that. And you want to get your heart rates up. You want to get it above your resting rate. And so, as you can see with age, as you get older, that target rate goes down, doesn't it? Right. So you guys looking at 20 years old, vigorous activity, you should have a heart rate of 200. I mean, if you're in moderate activity, you want to keep it in that aerobic zone. It should be, less than 170 or so. Again, I'm talking to you guys that some of you study this more professionally. And then if you're 50 years old, you can see, yeah, my target rate, yeah, I'm talking like 140 or something like that instead of 170. So you can see that. Cool. And someone that wore a Fitbit, I don't have a Fitbit, it's not an advertisement at all, but taking a look at your heartbeat over time is kind of cool. And of course, you can see when the person's sleeping and your heart rate is lower. How do you like that? And then you can see, I think this person went to work at like 8. They biked sometimes and went home at 5. And so you can see heart rate peaking then. So, and oh yeah, you can look at their activity. This is steps. So with our technology, you can follow your heart rates every day, your whole life, and graph it out if you want to take a look at that. And, if you notice the person's, at 60 beats a minute, looking good at resting, but, if you were monitoring it, if you found there's like 70 beats a minute, you could probably think that something is wrong or you're stressed or something like that. Oh yeah, and then also looking at, this is Fitbits. They looked at 20 million Fitbits across 65 countries, so they can kind of look at all this data anonymously. And they found the most fit country was Ireland. I wasn't going to guess that at all. UK was up there above the US too. But they looked at here, we're looking at activity, per day. You can look at a Fitbit and look at resting heart rate. Another thing you look at is that most people's resting heart rate on average between 61 and 68, right? Yeah, kind of cool. And so, yeah, we can look at big picture, where are people more active than others. Last one, just kind of look at, here's age and heart rate. And there's a couple things I just want to point out is that you can see it. There's kind of where the heart rate is lower among you young people, and it gets higher in middle age, and it can go down with old age as well. So it's subtle here, right? And then also notice for athletes out there, we're looking at a lower heart rate. And the reason is because you have a greater stroke volume. You can keep a high cardiac output by keeping a lower heart rate, but having a greater stroke volume. If you're less in shape, you have a higher heart rate because your stroke volume will be less. All right, so finally, what a chapter. I've taken weeks. We've gone through the heart in quite a bit of detail, right? From its anatomy and electrical, the plumbing, and then we looked at the major arteries and veins talked about today. And put that together with the blood that we learned about and clotting and all of these things. And it's pretty impressive. All right. With time, your cardiovascular system goes to hell. Right? It just gets worse, right? And of course, there are those that keep active into their elderly years, and their hearts very little change in cardiac output and anything like that. But most people get hardening of the arteries, this atherosclerosis. 60% of men over 60 have a narrow artery in their heart. Women, it's a little less. That's a huge amount of people over 60, which is not even that old. So, and that's a narrow coronary artery could lead to angina and a heart attack, right? The heart generally enlarges, but instead of being a larger athletic heart, the heart is a lot of fat infiltrates it. And when cardiac muscles give out, it turns into scar tissue and fat. So although you have a bigger heart, it's less effective. You have less contractile, less cardiac output because of stroke volume. Yep. Cardiac muscle cells. And again, they just don't regenerate. They just don't want to. As I mentioned, more fat and more fibrous tissue instead of having healthy, young, it's all muscle, right? Blood pressure, again, is a thing that goes up with age. It's related to the hardening of the arteries, really. Yeah, and as I mentioned, the heart rate can increase in middle age and then go back down again as you get older. All right, so one of the major killers, number one, in some lists is heart disease. All right, so this chapter, I hope you guys are studying. We have next week, I'll talk about the immune system. Really interesting. And also, very important around this time. I made some slides the other day about COVID and the vaccine there. I'll talk about vaccines. So that's what we have left. And so it's up to you guys to be listening to this, taking some notes so that you are ready for the test when I ask you about the major arteries and veins of the body. All right, you guys? All right, I'll see some of you tomorrow. It's Tuesday, late afternoon. All right, bye, you guys.